Good day, everyone. As men grow older, health becomes less about appearance and more about longevity, energy, and quality of life. One area that deserves serious attention after the age of 60 is prostate health. The prostate may be a small gland, but it plays a major role in men's health, and unfortunately, it's also one of the most common areas where cancer can develop as men age. Hearing the words prostate cancer can be frightening, but the good news is that while no one can guarantee prevention, research shows there are natural, proven ways to reduce risk and support a healthier prostate. Today, we're going to talk about 5 powerful lifestyle habits that can make a real difference in protecting prostate health after 60. These are not magic pills or expensive treatments. They are practical, natural strategies that support the body from the inside out. The first proven way is to eat a prostate-friendly diet. What you put on your plate every day affects inflammation, hormone balance, and cell health throughout your body, including your prostate. Diets high in processed meats, fried foods, excess sugar, and unhealthy fats have been linked to inflammation and poorer health outcomes. On the other hand, foods rich in antioxidants, fiber, vitamins, and healthy fats help protect cells from damage. Tomatoes are especially known for containing lycopene, a powerful antioxidant that may support prostate health. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that help the body detoxify harmful substances. Fatty fish such as salmon provide omega-3 fats that may help reduce inflammation. Nuts, seeds, berries, green tea, and olive oil can also be valuable additions. After 60, food is no longer just fuel. It becomes medicine or poison, depending on the choices made day after day. The second proven way is to stay physically active and maintain a healthy weight. Many men become less active with age, but movement remains one of the strongest natural protectors against chronic disease. Regular exercise improves circulation, lowers inflammation, supports immune function, and helps regulate hormones that can influence prostate health. Even moderate exercise makes a difference. Walking for 30 minutes a day, swimming, cycling, stretching, or light strength training can improve overall wellness. Being overweight, especially carrying excess belly fat, has been associated with a higher risk of aggressive health problems, including certain cancers. Exercise does not have to be extreme, it simply has to be consistent. The body responds to movement at any age, and the prostate benefits from that healthier internal environment. The third proven way is to manage stress and prioritize quality sleep. This is something many men underestimate. Chronic stress affects the body in ways that go far beyond mood. Stress hormones can increase inflammation, weaken immune defenses, disrupt hormone balance, and negatively affect overall health. Poor sleep also has consequences. During sleep, the body repairs damaged cells, regulates hormones, and strengthens immune function. Men who regularly sleep poorly may experience increased inflammation and lower resilience against disease. Simple habits such as reducing screen time before bed, keeping a regular sleep schedule, practicing deep breathing, spending time outdoors, or engaging in relaxing activities can help improve stress levels and sleep quality. A calm mind and a well-rested body are powerful allies in long-term health. The fourth proven way is to protect your body from harmful habits and toxins. Smoking damages blood vessels, increases oxidative stress, and exposes the body to cancer, causing chemicals. Excessive alcohol can also create inflammation and place strain on many organs. Environmental toxins matter too. Pesticides, certain industrial chemicals, and unnecessary exposure to pollutants may contribute to long-term cellular damage. While no one can avoid every toxin, reducing exposure where possible is a smart step. Choosing cleaner foods, avoiding tobacco, limiting alcohol, drinking enough water, and supporting liver health all help the body better defend itself against damage over time. Small daily choices can either burden the body or strengthen it. The fifth and perhaps most important proven way is to get regular prostate screenings and listen to your body. Natural prevention is powerful, but it does not replace early detection. Many prostate problems, including cancer, may develop quietly without obvious symptoms in the early stages. That is why regular medical checkups after 60 are so important. Discuss prostates, specific antigen testing, digital exams, urinary changes, family history, and any unusual symptoms with a healthcare professional. Pay attention to signs like frequent urination, weak urine flow, blood in urine, pelvic discomfort, or unexplained pain. Not every symptom means cancer, but ignoring warning signs can delay treatment. Knowledge is not fear. Knowledge is protection. The truth is, prostate health after 60 is not about one miracle cure. It is about building a lifestyle that reduces inflammation, supports immunity, balances hormones, and catches problems early. Eat wisely, move daily, sleep deeply, avoid harmful habits, get checked regularly. These 5 natural strategies may seem simple, but simple habits practiced consistently can change the future. Age does not mean giving up control over your health. In many ways, it means taking it more seriously than ever before. Your prostate health matters, your future matters, and the choices you make today can help you live stronger, healthier, and with greater confidence for years to come. Thank you. As men move beyond the age of 60, protecting prostate health becomes an increasingly important part of maintaining overall well-being and quality of life. The prostate is a small gland, but its health can significantly affect urinary function, hormone balance, comfort, and long-term disease risk. While aging itself is a factor that cannot be controlled, many lifestyle habits can influence how well the body protects itself against inflammation, cellular damage, and the kinds of changes that may contribute to prostate problems over time. Natural lifestyle habits do not promise absolute prevention, but they create a healthier internal environment that supports the body's defenses and reduces many of the risk factors linked to prostate disease. This is why everyday choices become powerful tools in supporting prostate protection after 60. One of the most important lifestyle habits begins with food. Diet has a direct effect on inflammation, hormone regulation, circulation, and the health of cells throughout the body. Men who regularly eat processed meats, fried foods, excessive sugar, and heavily refined carbohydrates may create conditions that increase inflammation and oxidative stress, both of which can harm healthy cells over time. On the other hand, a diet rich in colorful fruits and vegetables provides antioxidants that help neutralize harmful free radicals. Tomatoes, especially when cooked, contain lycopene, a plant compound that has been widely studied for its connection to prostate health. Leafy greens, broccoli, cauliflower, carrots, berries, citrus fruits, and other nutrient-dense foods supply vitamins, minerals, and protective compounds that support cellular repair and immune strength. Healthy fats from fish, olive oil, nuts, and seeds can also help reduce inflammation and support hormone balance, which becomes especially important as men age. Fiber is another essential part of healthy eating because it supports digestion, blood sugar control, and weight management. Whole grains, beans, vegetables, and fruits help maintain a healthier metabolic state, which indirectly benefits prostate health by reducing obesity-related inflammation. Drinking enough water also plays an important role in urinary tract function, and helps the body flush waste effectively. Proper hydration supports the bladder and urinary system, which often become more sensitive as men age. Physical activity is another powerful natural protector. Many men slow down after retirement or with age-related stiffness, but the body continues to benefit from movement regardless of age. Exercise improves blood flow, strengthens the immune system, reduces inflammation, and helps maintain a healthy body weight. Men who remain active tend to experience better hormone regulation and metabolic health, both of which can influence prostate wellness. Walking, swimming, cycling, stretching, yoga, and light resistance training can all provide benefits without requiring extreme effort. Even a daily walk can improve circulation and help reduce the accumulation of abdominal fat, which is linked to increased health risks. The goal is not intense athletic performance, but regular movement that keeps the body functioning efficiently. Maintaining a healthy weight is closely connected to exercise and nutrition. Excess body fat, particularly around the abdomen, is not just a cosmetic issue. Fat tissue can contribute to chronic inflammation and hormonal imbalances that affect overall health. Men who carry excess weight often have increased levels of inflammatory markers, and these can create a less favorable environment for healthy cellular function. Losing even a modest amount of weight through improved eating and physical activity can positively affect blood pressure, insulin levels, energy, and inflammatory balance. Stress management is another often overlooked factor in prostate protection. Chronic stress does more than affect mood. It influences hormone levels, weakens immune function, disrupts sleep, and increases inflammation throughout the body. Over time, prolonged stress can create a physical burden that affects multiple systems. Men often carry stress silently, especially after years of work, family responsibilities, and health concerns. Learning to manage stress through relaxation, breathing exercises, prayer, meditation, hobbies, nature walks, or spending time with loved ones can have a measurable impact on overall health. Emotional well-being is deeply connected to physical resilience. Quality sleep is equally essential because the body performs many repair functions during rest. During sleep, cells recover, hormones rebalance, immune defenses strengthen, and inflammation can be better controlled. Poor sleep or chronic sleep deprivation can disrupt these important processes and leave the body under greater strain. Men over 60 should aim for consistent, restful sleep by maintaining a regular bedtime, reducing caffeine late in the day, limiting screen exposure before bed, and creating a calm sleeping environment. Avoiding harmful habits is another major step in natural prostate protection. Smoking exposes the body to toxins that damage blood vessels and increase oxidative stress. Excessive alcohol can contribute to inflammation and weaken overall organ health. Limiting or eliminating these habits reduces unnecessary strain on the body and supports healthier aging. Reducing exposure to environmental toxins where possible, choosing fresh foods, and minimizing unnecessary chemical exposure can also support long-term cellular health. Regular health awareness remains part of a healthy lifestyle because paying attention to the body allows men to respond early to changes. Monitoring urinary habits, energy levels, sleep quality, and overall health can help identify issues before they become more serious. A natural lifestyle works best when combined with awareness, consistency, and proactive care. The body responds to daily habits over time, and every positive choice contributes to a stronger foundation for prostate protection and healthier aging after 60. Early detection plays one of the most Important roles in protecting prostate health after the age of 60, because many prostate-related conditions can develop slowly and quietly without causing obvious symptoms in the beginning. This is one reason prostate problems can sometimes go unnoticed until they become more serious. Men often assume that if they feel normal, everything must be fine, but prostate health does not always work that way. Conditions such as prostate enlargement, inflammation, and even cancer may progress silently in their early stages. This is why awareness, routine medical attention, and listening to changes in the body become essential parts of long-term health. Detecting a problem early often means having more treatment options, better outcomes, and a greater chance of managing health successfully. One of the challenges with prostate health is that many symptoms, when they do appear, can be mistaken for normal aging. A man may notice that he urinates more frequently at night, has a weaker urine stream, feels like his bladder does not empty completely, or experiences urgency that was not there before. Some men ignore these signs because they assume it is simply part of getting older. While aging can affect urinary patterns, these changes should never be dismissed without evaluation. Symptoms can be caused by non-cancerous enlargement, infection, inflammation, or in some cases something more serious. Paying attention to these changes and discussing them with a healthcare professional allows problems to be investigated early rather than waiting until symptoms worsen. Routine screening is often a key part of early detection. Medical professionals may recommend prostate-specific antigen testing, commonly known as PSA testing, as one way to monitor prostate health. PSA is a substance produced by the prostate, and elevated levels can sometimes indicate that further investigation is needed. It is important to understand that PSA levels alone do not diagnose cancer because they can rise for several reasons, including benign enlargement or inflammation. However, PSA testing can still serve as a useful warning sign when interpreted in the context of age, symptoms, family history, and other medical findings. This is why screening decisions should be personalized and discussed with a qualified healthcare provider. Physical examinations also remain important. A doctor may perform a digital rectal examination to feel for changes in the size, shape, or texture of the prostate. While some men feel uncomfortable thinking about this type of exam, it can provide useful information that cannot always be detected in other ways. Early detection is not about fear or embarrassment. It is about taking practical steps to protect long-term health and catch problems before they become harder to treat. Family history is another factor that should never be ignored when thinking about prostate health. Men who have a father, brother, or close relative with prostate cancer may carry a higher risk and may need earlier or more careful monitoring. Knowing family medical history can help doctors make better screening decisions and identify whether closer observation is necessary. Genetics cannot be changed, but awareness of inherited risk allows men to take action sooner. Long-term prostate health also depends on consistency. A single checkup does not guarantee lifelong protection. Health changes over time, and the prostate can change gradually with age. Regular follow-up appointments allow doctors to compare results, track PSA trends, evaluate symptoms, and notice patterns that might not be obvious from a single test. This ongoing monitoring creates a clearer picture of health and helps reduce the risk of delayed diagnosis. Another important part of long-term prostate care is understanding that prostate health is connected to overall body health. High inflammation, obesity, diabetes, poor circulation, chronic stress, and unhealthy lifestyle habits can all affect the body's ability to maintain healthy cells and proper organ function. Men who focus on long-term wellness by eating nutritious foods, staying physically active, maintaining a healthy weight, sleeping well, and avoiding smoking support not only their heart and metabolism, but also their prostate health. Early detection works best when combined with healthy daily habits because prevention and monitoring strengthen each other. Communication with healthcare providers is also essential. Some men avoid discussing urinary symptoms, sexual changes, pelvic discomfort, or other personal concerns because they feel embarrassed or believe these issues are not important. This silence can delay diagnosis and treatment. Honest conversations allow doctors to understand what is happening and recommend the right tests or treatments. There is no benefit in hiding symptoms when health is at stake. Mental attitude also matters in long-term prostate health. Fear of diagnosis can sometimes keep men from seeking medical advice, but avoiding knowledge does not eliminate risk. In reality, early detection often reduces fear because it provides clarity and creates opportunities for action. When health issues are identified early, they are often more manageable, and treatment decisions can be made with more confidence and less urgency. Aging does not mean surrendering control over prostate health. It means becoming more aware, more proactive, and more committed to routine care. Monitoring symptoms, attending regular screenings, understanding family history, maintaining communication with doctors, and supporting the body through healthy living all contribute to stronger long-term prostate health. The goal is not simply to react when something goes wrong, but to stay engaged with health consistently, allowing small warning signs to be noticed early and giving the body the best chance to remain strong and healthy through the years ahead.